So it's the second Greek speaker in one morning. I hope that's not too much for you. Mike is right. I did train with the BMAS back in 1998. So I would like to thank the BMAS and especially Dr. Cummings for inviting me here because for me it's a very special honor. And I do work once a week as a honorary research fellow at the same university. It's the Aristotle University of Thessaloniki. And this is basically a study within a study. It's a preliminary study in order to decide which points we should be using for my future PhD thesis. And Dr. Vasilakos is going to be supervising it. And these are the people that helped a lot in this study, especially Dr. Cummings and Dr. Ludeberg. You see why. Is obesity important? I mean, why should we really care? They're not. We thought there weren't too many studies relating acupuncture to obesity. But then, a few years ago, we saw some very alarming statistics. These are the obesity rates in Europeans, very young Europeans, from 15 to 25 years old, who have a BMI over 30. And as you see, Greece has the worst results. And we do know there's a new study coming out that's showing that other countries have gone bad as well. And it's not just Greece and Europe, it's the whole world basically. We have 1.1 billion people in this world that are classified as overweight. It ranks 5th, but according to who, it will go higher up. And then either the airlines will have to construct much larger seats, there is a demand for that in the States, or we will have to find other ways to treat obesity. And as we all know, these are the most common comorbidities associated with obesity. We see quite a few of them at the Clinic of Internal Medicine where I work at. We see a lot of hypertension, cardiovascular diseases, diabetes. And the main problem with obesity is that, of course, if obese people would diet, it would be fantastic. If they could change their eating habits, there would be no problem. And if they could exercise, that would be great too. But it's extremely difficult to persuade these people to change their habits and to walk more. And we're not happy with the existing drugs, as you all know. Bariatric surgery, we're not happy with the data we already have. So it would be nice to find also another option to maybe change some of the metabolic abnormalities in these people. So this is Dr. Hadjitoyos in the center, who is professor of internal medicine next door to Professor Vasilakos. And he had the idea of forming a cardiovascular risk outpatient clinic. It's a university clinic, and he wanted to offer one more option and was brave enough in not a very positive environment to add acupuncture as an option. But of course, we always have the internist who examines the patients. We have a dietitian, psychotherapist and psychiatrist, and a physical trainer to give them some exercise advices. Because there's so many parameters that are involved that it's really difficult to target just to one of them. But the question still remains, and it's not clear. Can electro have a role in treating metabolic abnormalities? In order to find out, Professor Hadjitoyos asked us to write a review on the existing data. And it took ages to write this review because of many reasons. But when we did write it in the end, and it's now online in Acupuncture and Medicine, we could roughly say that yes, experimental and clinical current data suggest that acupuncture exerts beneficial effects in obesity, which was good. We mostly have animal studies, and it seems, although it's not very clear, but it does seem that there is evidence that suggests that acupuncture has multifaceted favorable effects on obesity, such as regulation of the orexigenic and anorexigenic peptides, which means satiety centers in the arcuate nucleus. Also, insulin resistance, lipid profile, inflammatory markers, and glucose levels. But one of the reasons it took so much time to write it, it was because most of the papers on obesity and acupuncture weren't of very high quality. And they had small number of trials, number of patients, huge methodological flows in some of them, and at large, the message from our review was that it is absolutely necessary to have more well-planned and long-term studies in order to really investigate the effects of acupuncture in the treatment of obesity. So we decided, since we are receiving so many patients at the outpatients clinic, to examine this ourselves as well. And it was Professor Vasilakos and Dr. Cummings who suggested that we could measure hard endpoints, such as glucose levels, insulin resistance, inflammatory markers, and peptides, in order to see whether electroacupuncture can alter any of these parameters. So the bigger study, the main study we will be doing in the future, will have two groups of obese patients, two groups. 30 patients will diet and exercise and have electro, and the other 30 will have sham electro, but will have to diet and exercise as well. And again, the most interesting question, in order to do this big study, which will be part of my PhD, was which points? How, if we're going to do such a big study that will involve a lot of acupuncture, at least 3 times a week for 2 months, then it's good, before we choose the points, to have some indication on which points would be better to use, if there are any. It took some time to decide. Well, we know that there's a lot of experimental data to support segmental choice of points. Dr. Carr previously talked very nicely about it. He was very good. And these are Lisa's rats, Lisa Steiner. The interest in treating, they had more cheese than they should. Well, the interest in treating metabolic abnormalities basically started with the work of Lisa Steiner when she started measuring metabolic parameters in PCOS rats. And she has data that suggest that electro does alter some of them, such as insulin resistance, and sympathetic tone activity and inflammatory markers. And from the review, we have seen mainly studies in rats that suggest there is a drop of glucose. They've used several points. So I don't want to tire you with this. It was a long discussion between Dr. Cummings and Dr. Lundeberg. Dr. Lundeberg suggested segmental points that correspond to the innervation of the pancreas, bladder points. On the other hand, Dr. Cummings suggested big points from arms and legs, muscles. Again, it's very interesting because it mainly, if we want to be fair, it mainly comes from the Scandinavian tradition this whole discussion, because it was a paper that was first published in a medical hypothesis by Dr. Anderson and Dr. Ludeberg, and first talking about the role mechanoreceptors in muscles may have as an underlying mechanism. And in the review we did, we saw many other suggested hypothetical always mechanisms. Whether the parasympathetic system, for instance, plays a role, it's a very interesting question that hasn't been answered. Free fatty acids as an insulin inhibitor, do they play a role? We don't really know yet. IRSA GLUT4, that's Lisa again, a very recent paper published by her team. And beta endorphin, of course, that it is in many papers. Although none of these mechanisms is clear yet. And we always have to remember that we are treating severe obesity, BMI over 30, they're really obese. And in order to define the best points for the big study, we decided to do 3 groups. One group with bladder points, one group with limb points, and one group with ear points. Blood glucose levels were measured immediately before, that is morning fasting blood glucose, before and after acupuncture. So the first group, according to Dr. Lundeberg, bladder points bilaterally, thoracic 9, lumbar 2, that correspond to the innervation of the pancreas, and that's the bladder meridian. Second group, that's Dr. Cummings, points from the limbs. That's the second group, arms and legs. It's interesting, and it played a major role. We are talking about obese patients. That is not always easy to find, for instance, where stomach 36 is, because you may find that there's a huge bulk of fat underneath. So, and if you want to have muscle contractions, you have to be a bit flexible on the points you're choosing. And you may just have to make sure you're on a big muscle like tibialis anterior, rather than being very unhappy for not finding stomach 36, for not being able to get muscle contraction. And the third group, the ear group, only because there is some data that suggests that you can affect vagal tone if you use ear points. This is the Cephar machine that Dr. Lundeberg was very kind to lend to us. So we used the 2 Hz burst pulses for the first 2 groups, for the bladder group and the limb group. For 30 minutes, we used the 10 Hz for the ear group. A very quick look at the definition of obesity. We announced then the study at the outpatients clinic, and there were 16 women that volunteered, obesity, BMI over 30, from 30 to 52 years old. We had quite a few exclusion criteria like hypertension, diabetes, thyroid problems, cardiovascular disease, and any kind of medication. And then we had to ask the permission from the ethics committee of the university, have a written consent prior to beginning the trial, and then there was a computer randomized the groups. And our results. We were quite surprised to see that in both the bladder group and the limb group, there was a statistically significant drop of the glucose levels. But there was no statistically significant difference between the 2 groups. On the other hand, there was no glucose drop for the ear group. The statistician, in fact, was more surprised because he didn't really believe we would have any results at all. And this is, these bars show glucose levels before, after, and the little green ones is the difference. And we can see again that back points, glucose is dropping, limb points, there's one that doesn't limp through. Limb 3 has no effect on glucose levels, but all the others, they're dropping. Ear points, they are augmenting in some cases. Glucose difference, again. So our conclusion is that it's very interesting that only one session of electroacupuncture at either of the two groups indeed produced a statistically significant drop in fasting blood glucose levels. Do we know the underlying mechanisms really? We don't. But for practical reasons, although both groups worked very well, we decided to do the limb points because they are obese, these patients, very difficult to dress them and undress them. We don't have enough space at the moment. You know, Greece is not in the best financial situation, so we don't have too many rooms, we don't have too many facilities, so we have also to think of practical ways to continue our research. So we will be using, in the bigger research, we will be using limb points, and probably since Petra is here and is lecturing in the afternoon, we'll be collaborating with the Germans to do some psychometric studies and measure other things such as anxiety and depression and whether these can change with acupuncture. So we have a lot of work to do in the future. Thank you very much.
Could you just go back to the results slide?
Okay.
Yeah. Okay, so we'll have some questions now. It's I didn't think it was going to be so interesting, this little pilot study, but it luckily, with the results, we didn't predict these results, and it's caused quite a lot of debate, mechanistic debate. But a lot of it, of course, was practicality again as well, and I don't envy Maria's task in having to do so much acupuncture to influence a metabolic outcome. The data suggests you have to do quite regular treatment.
Maria, thank you very much. It's really brilliant work, and thank you also for the review article, which I picked up on recently. It was really, really interesting. I just wanted a question about intensity, and I may have missed this.
Yes, you're right. Yes.
I wanted to just check, and just thinking logically, it's quite hard to get the same degree of intensity with electroacupuncture in the ear, where there's very little muscle, compared to those lovely big stomach points, which we can use for strong central stimulation. So I wonder what the differences were in the intensity you achieved in that third group, and whether you think that may have had an influence on central mechanisms.
That's an excellent question. I forgot to talk about it. Probably, if we were talking about muscles, and you think about the ear, and you think about big muscles in four limbs, yes, probably it has to do with that. And intensity was a very interesting thing because of the obesity and because being on the underlying muscle was not always easy. And you always had to turn it on before the end of the treatment because you wouldn't get any muscle contraction, so they would get used to it. Intensity in the ear, you could not see any contractions in the ear.
And one other question, sorry, was with these fasting glucose levels you looked at, did you look at fasting insulin and try to calculate the HOMA index or any other measures?
No, we didn't do. We did.
Do
although we have kept the blood, we have kept more blood samples, but and Dr. Ruderberg suggested also free fatty acids, but we couldn't find the kit, and the whole thing was taking ages. So we just thought, okay, glucose.
But you can go back to that serum or plasma.
Theoretically, yes.
Okay.
Yes.
But do you suspect that you might need a more sustained treatment to affect insulin sensitivity markers like that?
Exactly, that was the idea. Okay. That was the idea, and Dr. Cummings suggested that we may need to do a lot more in order to affect other parameters. But glucose, for the beginning, was really fine.
So yes, the idea was to get the best guess for what was done in the definitive paper, and not, you know, can imagine if you'd gone with some of the research and picked ear points, and then that would have been very annoying, wouldn't it? So it's lucky that we've got a clue to the direction to go in, and then, you know, combining it with the practicality of being able to do it rapidly. Intensity, I didn't think about that, Maria. How much did you turn up the machine?
It varied a lot. It depended, because we're talking about Greek patients, a bit more sensitive probably. So it varied. But I think I have a slide. It must be between 1.1, 2 points, more or less. 1.2, 2.2. But it varied. I mean, you had someone very obese and you could get muscle contractions with lower intensity, whereas you had someone smaller and you needed...
And what about the ears? What did they say? What did the patients say as you were turning up the intensity for
Nothing
their ears?
most of the times.
Nothing?
Yes.
So how did you know how far to go?
I asked Dr. Lundeberg what to do.
And what did Dr. Lundeberg say?
He said, don't go too far, go to be between 1 point something, 1.5 and
3.
Yes.
Yeah, okay.
Yeah.
So that would be consistent with
They would have a dead chi, they would have
Right.
a very small filling, but they wouldn't have anything that you could really be based on and, you know, increase or decrease intensity.
You mean they didn't have muscle twitch?
Exactly.
We have a question over here.
Just a simple question. I know they measured the glucose. I might have missed it. Is there a weight reduction?
I'm sorry?
Was there a weight reduction in patients?
Yes, one day, one treatment. Weight reduction.
One treatment. This all happened in less than an hour.
Okay.
We took blood from them, immediately stick needles onto them. 30 minutes later, another blood sample, and that was it. It all ended up in 50 minutes, even less.
How about their hunger levels? Did they miss a meal saying that we don't feel hungry
I'm
anymore?
sorry?
How about their hunger level? Did they feel that they don't need
Hunger
a meal?
level.
Yeah.
Oh, this is another study we're doing about hunger levels and satiety levels. We didn't measure that. Obviously, they were hungry because they've been fasting, they've not been eating anything for the last 8 hours at least. So I imagine they were already very hungry.
Did you get, off the record, did you get any impression as to which points work best?
I don't really know. Sometimes I thought the bladder points were better. Sometimes. But again, it was so difficult to find muscle in the back of these people. And I was so worried about where I am with my needle. I didn't want to have huge needles on them for obvious reasons. So I thought it's safer, by all means, to have limb points.
No.
Why do you think that obesity levels are so great in Greece when the Mediterranean diet is promoted as a very healthy diet?
Oh, that's the best question, because they're not doing the Mediterranean diet. That's why. That's the problem. Exactly. No, I mean, being more Western has changed that. My dad was born in the island of Crete, and I'm sure many of you know the big study they did in many countries, and they found that the inhabitants of Crete used to be some of the healthiest people on this planet. And I remember my grandmother in Crete cooking just vegetable and snails and very low-fat stuff, and people exercising and, you know, going from one village to the other on foot. Whereas when they started eating fast food and processed food and using the car every day, this has changed eating habits a lot. So it's not Mediterranean diet is a theory. we don't do it. I mean, we eat more vegetables. I can see that because I've lived in both countries. We eat more fruits, but we are far away from the past.
Sorry to interrupt the last speaker. On a practical level, have you considered going, say, for instance, stomach 36, going straight down to the periosteum and then withdrawing so that the variation of fat is avoided? Because it must be one of your problems practically is getting the needle at a reasonable depth.
Exactly, yes.
So would you consider going right down to the periosteum and withdrawing?
No. No, not really, no. Because I wanted to be very sure. We only had 16 people to examine, 6 people in this group. I wanted to be very sure I am in the muscle. I didn't want to risk anything. So no, if there was a huge bulk of fat, couldn't get any muscle twitches, I would just move further because I think as a person, I don't believe it's stomach 36, really that's important. I believe we are important on the tibialis anterior. Sorry to say that.
And technically, stomach 36, correctly placed, shouldn't hit periosteum. It should hit the interosseous membrane. And unfortunately, there's a big artery there. So it wouldn't be safe to do it quite like that. You'd have to alter your angulation. Could you feel, Maria, the transition easily from fat to muscle?
Not always, but I could feel it, and I would choose the point where I could be sure I'm feeling the transition. If I wasn't sure, I was moving up and down.
And you could then check by getting muscle contraction?
Exactly, yes. Yep. But I wouldn't do anything unless I felt the transition.
Yes, David.
I have an obvious question, and I'm worried that I might have missed the answer in your presentation, but why did you only study women?
It's not obvious. I just forgot to explain it. Because our clinic runs only once a week and only in the morning, it's easier to get women into that clinic because there are a lot more women not working and taking care of the kids, as in many other countries. And also because men are not very easily motivated to have their obesity problem treated in a public hospital, I would assume. But we do get a lot more women than men. So we decided not to mix. We had a few men, but we decided not to mix the groups and only have a clear group.
Do you think that's a problem, David? Oh, you haven't got the microphone anymore. I mean, normally in pain research, it was a problem in the old days not having enough women or not doing research on women. So I think women are the more complicated from a research perspective, as well as some others.
And others, probably.
Mark,
so I've not seen your literature review, but what came out of that in particularly the Chinese RCTs on obesity in terms of the points that they used? Presumably they probably concentrated quite a lot on stomach and spleen points. And also just another point, I don't think it was brilliant though her work's been. Stina Victorian, who started doing research on acupuncture for metabolic disorders.
Yes, the problem with the Chinese papers, and in the end we had to exclude a lot of them, as Dr. White knows very well, is that we couldn't work with the summary. So we had to find the full text in English. It was very tricky. We had many universities working together with us. I would send it to Dr. Cummings or Dr. Lundeberg in order to find the full text in many countries. And when it was completely impossible, we would just not use the paper at all. But yes, they were using stomach points, spleen points, CV points a lot, and ear points.
And yes, no, in terms of the metabolic work and Lisa's work, she was the first to show an effect on insulin resistance. So that was why we particularly were interested in that and in her protocol.
And Lisa did her PhD with Dr. Lundeberg. So again, it's a long Scandinavian tradition on that.
Petra.
Yeah. Yeah, thank you for the great presentation and the encouraging results. I have a question for the further study you'll be doing. Since obesity has also very many individual reasons, also in psychological terms, would you also consider to add more individually chosen points as well, depending on the condition of the patient?
No, we did all this study in order to be sure about the points. No, we're not, because this will make things extremely, we have thoughts a little bit about it, but this will make things extremely complicated. And the only thing, because there's so many parameters involved into addictions generally, and into obesity problems, into smoking problems, so many other things. We have the psychiatrist and the psychotherapist, and they're not enough, if you can believe this, because there are many, many other issues underneath. So you cannot just see it mechanically. It's really not very clever. The only thing we're going to do is work with you on psychometric studies, but we're not going to alter the points.
Yeah, we will do.
Thank you very much. Thank you very much. Really, you're doing work into basic research, the effects of what acupuncture does to various parameters in the blood. Can you future pace at all to a general application for therapy?
You mean use this research as that would be ideal. I mean, we would all be very happy if we have so good results, and that's the whole idea. That's why we take the trouble to do this, because we are all on a volunteer basis. We're not being paid for that, and the university doesn't have the money to pay for all this. We won the first prize from the Obesity Society of Greece, because they're very interested. But other than that, everybody, all the team you've seen are people who are not being paid and do this in their spare time. So it's a huge effort. And it would be lovely if we could affect these parameters as a therapy, yes.
According to Lisa's work, I think she saw the best. She only saw effects when she was doing daily treatment, didn't she?
Yes.
And that was in both rats and humans.
Yes.
So 5 days a week, basically, which concerns us a little, because it would have been impractical in the circumstances to do that, and so it's a bit of a compromise to go for three times a week when you're trying to influence metabolic factors.
Would it be practical to do it to get a number of my patients self-treat 2, 3, 4 times a week? Do you think this would be practical for these patients?
That would be very good, but in Greece there is a legislation where you can only do acupuncture if you're a medical doctor. Unless you have a medical degree, you're not allowed to... No. No, so we would have problems with that. And this is a university clinic, and not everybody is very positive about acupuncture and all the things we're doing, so we have to be double as careful in what we do.
Neuromodulation.
It can't be illegal to treat yourself in Greece. I mean, that's just ludicrous. I don't believe it. I just don't believe it.
But if...
I've been quiet all today, and now my poster's on self-acupuncture. I cannot believe it's illegal in Greece to treat yourself. You're getting this, boys. You're getting this, boys. Yeah, I'll keep quiet now.
It's not just legal reasons, to be honest. It's also cultural difference. Greek patients would not be very happy to be given needles and and being trained and do this on themselves. And because it's a university clinic, as I said, we are very careful. We're not doing too many things at a time.
And I think this particular technique, where you're using strong electroacupuncture to muscles and in what the subjects would be difficult. I teach a lot of people to do self-acupuncture with electroacupuncture, but but I've never tried it on these people with BMIs over 30. So I think that would be another challenge. I'm not sure how many would do that. It tends to be a small proportion anyway. So, a question from the back.
So if it's a question of stimulating large muscles, do you have to have needles, or can you just use electrodes?
I'm sorry, if I have needles?
If it's just a question of stimulating large muscles, do you have to use needles, or could you just use electrodes?
I don't know. I've never used.
Right,
what do you mean electrodes? TENS machine. Yes.
That's a very good question.
It's a very good question, but for Dr. Ludenberg, not for me. You need to be a physiologist to answer it properly, I think.
Yes, and I think the answer is no, it wouldn't work with surface stimulation. And the reason for that is because we suspect that the mechanism is through stimulating high threshold fibers in muscle. High threshold fibers in muscle, and the muscle twitch is merely a side effect. And I've discussed this with Thomas for many years because he's emphasized the muscle twitch. But the muscle twitch is in itself is insignificant, physically insignificant, and it alone cannot be responsible for the similarity with strong exercise. The similarity with strong exercise almost certainly must be on the sensory side of the system, because on that side of the system, it is certain. If you've had strong electroacupuncture, you'll know it's like half a marathon, equivalent muscle ache, if you've done it enough, strong enough. But the muscle twitch is pathetic, absolutely pathetic, and a couple of walks around the room would be easily more than 30 minutes of electroacupuncture in terms of muscle activity, motor activity. So I think the motor activity is merely an epiphenomenon that gives us an idea that we're stimulating certain nerve fibers. Hang on. TENS machines are surface stimulation. I've had this discussion a lot. Surface stimulation, and whilst you can get muscle twitch, you get muscle twitch because of recruiting low threshold motor fibers that are near the surface. You do not get stimulation of high threshold fibers in muscle. It never aches afterwards, deep in muscle. You get a tiredness feeling. You get a certain tiredness feeling because of the way electrical stimulation of motor fibers works. It's slightly different from the normal recruitment patterns, but you never get the intense ache in your tissues that you get from needles or electroacupuncture. Do you want to come back? Okay, David.
Another question about mechanism, just with the drop in blood pressure, blood glucose. I think in some of the rat work there was an upregulation of GLUT for another glucose transporters, so implying more is being brought into the cell. But because that's quite a medium to long-term effect, clearly in this cohort that probably isn't a realistic mechanism.
Yes, Lisa's paper was that.
Yes, so in the rat stuff. So do you think that this might be a reflection of glucose consumption by the muscle during the stimulation in the same way as you get in exercise in a fasted patient, or do you think this might be effects on pancreatic insulin secretion?
In my opinion, it could be both. I mean, we don't have enough data to know which of these two things is more important. It seems that the first option is more the answer. But everything is an assumption because we don't know for sure which of these two works. Lisa suggests it's GLUT4 in her it's a very recent paper.
And are you going to look at GLUT4 expression in your main study? And in what tissue?
Good question. We could add that.
Yeah.
We could add that. I haven't discussed it with anybody.
And are you going to take fat biopsies and look at adipocyte count and size variation and things like that?
We're hoping to do this. We cannot measure too many things because the finance we have is limited. So we'll try and measure the strongest hard end points if possible and see if we have more money for the other parameters.
Let us thank Maria once again. And